Carpal tunnel syndrome is a condition that causes symptoms in the hand and fingers, like pain, numbness, and tingling that are often debilitating. But what causes carpal tunnel syndrome? It's actually a disease that affects the area inside the wrist known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid or forceful hand movements, that sheath can become damaged, causing microscopic rips in them, which naturally repair but then rip again. The cycle of rip and repair can happen hundreds of times, and in time, the repeated rip and repair process causes adhesions to form. These adhesions make it difficult for the tendons to work properly. The body reacts to the adhesions by producing inflammation and swelling of the sheath. As the sheath swells, it pushes against the median nerve and compresses it. And that nerve compression is what causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective and lasting, it must break up the adhesions and not just take pressure off of the median nerve. If you're one of the millions of people who have carpal tunnel syndrome, it's important to know that carpal tunnel surgery does nothing to address this problem of adhesions and inflammation. Surgery is not the effective and permanent way to get rid of your pain and other symptoms. Yet, there is a way to achieve this. Most people get 100% complete and lasting relief using deep tissue massage therapy. But this isn't your ordinary massage. Pressures are directed outward from your wrist with every circular motion. This longitudinal motion causes drainage of excess fluid from around the tendons, and the lateral motion breaks up the adhesions that cause the inflammation and swelling to begin with. Most importantly, to be effective, deep tissue massage must be performed daily and for a period of at least 2 to 4 weeks. Otherwise, it won't be able to alleviate your symptoms. However, thanks to a new technology, you don't have to make expensive and daily visits to therapy for this treatment. This technology is the Carpal Rx. You place it on your forearm twice a day for 15 minutes. It's carefully calibrated to produce the same motions, speed, and pressures that a therapist uses to perform deep tissue massage on your wrist and forearm. So get rid of those splints and braces that just don't work. And don't even think about having carpal tunnel surgery because studies confirm that most people who have surgery don't need it. Or when they do have surgery, the dissatisfaction rate is over 50% because surgery doesn't prevent tendons from swelling once again. If you have carpal tunnel syndrome or wrist tendonitis, you owe it to yourself to try this remarkable product. The Carpal Rx is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. It will do it easily, completely, comfortably, and cost-effectively. Remember, it's guaranteed to work for you. Visit the Carpal Rx at carpalrx.com.